Let's take a look at the anatomy of the knee and the ligaments being scrutinized in RG3's injury. The anterior cruciate ligament right there in the middle runs through the center of the knee joint and is critical to stabilize front and back motion of the leg. As we know, RG3 tore his in college. He also suffered a sprain to the lateral collateral ligament right there in purple. That runs along the outside of the knee and can be stretched when a hit is taken on the inside of the leg. That's what happened earlier in the season. So why isn't the current MRI definitive on what's going on right now? Well, I asked a local specialist to watch Coach Shanahan's press conference with me and give us his take.
Anytime there's an old injury, it confuses the picture. It makes things much more complicated. We become very reliant on technology, and this is an example where the MRI may not be exactly clear, and his doctor, Dr. Andrews, wants to use our old-fashioned methods, which is doing a physical exam, probably doing some functional testing, to really try to get to the bottom of this, and hopefully that will come up with more clear answers.
Dr. Eric Wysotsky is a physiatrist with MedStar National Rehabilitation Hospital. He says if the ACL is torn again, surgery is almost always part of treatment. Dr. Wysotsky also says the painful-to-watch angle of RG3's knee in his final play of yesterday's game could have been enough to inflame old injuries, or the result of the weakened ligaments simply giving out.
And I would not necessarily want to be in their shoes. I'm sure it's a challenging situation for everyone involved.
And as many second-guess why the franchise player was still in the game after clearly struggling, Dr. Wysotsky says it's an agonizing decision under pressure.
If you come into my office with an injury, it's not very complicated. We work through and get you back to your function. For these athletes, there's millions of dollars at stake. Everyone in the world is watching. The player wants to play. The coach wants to win. The medical staff is caught somewhere in between. So it can get very, very complicated and make these decisions very difficult.
And Dr. Wysotsky says sometimes the true extent of the injury across the knee isn't 100% clear until the player is in the OR. But he describes these guys as superhuman in their ability to heal and get back to peak performance a lot faster than you or me.